So you've just been told you need a thyroid antibody test and you're wondering what it is. Well, I'm going to go through what you need to know. Your thyroid gland is a gland that sits here. It looks a bit like a butterfly, and basically it produces hormones that regulate growth, metabolism, and other important bodily functions.
We will cover what antibodies are, how they affect you, causes of a raised test, and what it means.
Hormones are messengers that travel around your body and tell it what to do. In order for your thyroid to work, it has enzymes, which are chemicals which help produce the hormones. An example of an enzyme would be something called TPO, thyroid peroxidase. This enzyme is essential for helping produce your thyroid hormones. If something then attacks this enzyme, it's therefore harder for your body to produce the hormones that it needs. If you're having thyroid hormone imbalances, it's worth noting that this could mean that you have an overproduction, hyperthyroidism, or an underproduction, hypothyroidism. Each of these two conditions come with their own distinct list of symptoms and affect your bodies in different ways. If you have antibodies which are causing inflammation in your thyroid gland, it could lead to conditions like Graves disease or Hashimoto's. Your doctor might arrange these tests if you're feeling cold, lethargic, having weight gain. These can all be signs that your thyroid is not working as well as it should.
Symptoms of an overactive thyroid include a fast and irregular heartbeat, weight loss, diarrhea. You might have anxiety or trembling hands, a neck lump.
A thyroid antibody test is a useful diagnostic tool in working out whether or not you have these antibodies. They can provide useful clues as to what's going on if you're not feeling quite right. 3 examples of thyroid antibodies include thyroid peroxidase antibodies, number 2, thyroglobulin antibodies, and number 3, thyroid stimulating hormone receptor antibodies. When these antibodies are raised, it could mean your thyroid gland is having an immune response.
Elevated thyroid antibodies can also be found in type 1 diabetes, rheumatoid arthritis, celiac disease, and SLE.
Raised TPO antibodies is commonly found in Hashimoto's disease, and raised thyroid stimulating hormone receptor antibodies is often found in Graves disease. One essential piece of information to know is we still haven't worked out exactly why some people have these antibodies and some people don't. Just because you have raised antibodies doesn't mean you have a problem with your thyroid gland. It is also found in people who are totally fit and well. What it could mean is that you're at risk of developing an autoimmune condition in the future. So your doctor might bring you in for regular reviews or check in with you every now and then. Or if you develop symptoms in the future, it might be worth seeing a doctor a bit sooner. And if you have an autoimmune condition such as these, you're at higher risk of developing other autoimmune conditions and possibly ones that affect your thyroid. Reasons that your doctor might organise thyroid antibody tests include if you've got symptoms that they're concerned about, if you've got another autoimmune condition, and lastly, if they're monitoring an existing autoimmune condition. But if this test is positive and you have symptoms, it could provide us with useful clues to what's going on with your body. The thyroid antibody test is one part of the puzzle, and if you're concerned, it's important to speak to a doctor, and we're here to support you. Thank you for watching.